Today's topic has been in the news probably for the last several months just because we've had increase in the amount of people that have been using the weight loss drug Ozempic. Now, it is definitely not a weight loss drug. Today, I'll kind of tell you about what the drug is, what it was designed for, what it actually does to you. We'll talk about some of the side effects, and then we're going to talk about Ozempic Face. And this is really where my expertise comes into play, because with every medicine, there is a downside. So obviously, we want to be prepared for those downsides, whether it's from a chemical process within the body or if it's visual or phenotypic start of change. The idea is that we want to head it off at the pass and see if we can make things look better. So Ozempic, this was a drug otherwise known as semaglutide, which is a GLP-1 analog, so a glucagon-like peptide 1. And essentially what it does is multifold. One, it increases the amount of incretins, which is a hormone that produces more insulin in the body. Now, insulin is responsible for building up lean muscle mass and breaking down some of our fats. It also, this medicine prevents liver glucose from being administered into the body, released into the body. The third thing that it does is it actually gives the feeling of early satiety. And so that means that you constantly feel full. Now, you can see that the effects of this particular side effect lead to weight loss. Now, I can tell you we've got a number of different patients that are on it, have been very successful with it, and have lost anywhere from 5 to 40 pounds, essentially because it changes the portions of what you're eating. And outside of the chemical processes that I've talked about, obviously your caloric intake has been decreased. Now, again, this was a medicine that was designed for type 2 diabetes, anyone whose hemoglobin A1C was creeping up to the diabetic range. So if you are a pre-diabetic or have type 2 diabetes, the idea is we want to increase our insulin reserves or insulin sensitivity. And as a byproduct, this reduces the gastric emptying or outflow. It makes you feel full all the time. So it's a once-a-week injection. I know in other countries they do have an oral form that you take on a daily basis, but the route that has been FDA approved are weekly injections. So I know that there are a few other brands out there that are essentially, touted as weight loss drugs. These are essentially the same thing as a form of semaglutide. The problem that we run into, especially when it comes to aesthetics and plastic surgery, so there's two main ones that we have to think about. One is healing of wounds, and the second is volume loss with rapid weight loss. So there is a recent study published on semaglutide that ultimately shows a slight decrease in the ability to heal. So now, as a plastic surgeon, we have to start thinking, if we're going to operate on someone with Ozempic, the idea is, when is the appropriate time to either stop the medicine or do we recommend continuing? For us, I think the current recommendation right now is that we stop Ozempic for 3 weeks, then we can operate. And so the idea is we operate and then we give 3 weeks afterwards to allow you to heal, and then you can restart the Ozempic. The second problem that we run into is rapid weight loss. Now, imagine that we have a full balloon that has been rapidly deflated. So now it leads to a stretched appearance of that rubber. Same thing that happens with skin. So Ozempic Faces has become a front and central type of issue in the world of aesthetics because now we see aging. So I always say the same thing: as we age, you draw a line at the neck, and above or below that line, one of those is going to suffer. The more weight you have below, the face looks younger because it's rounder and smoother. The less weight you have below, the face deflates, and we can see a loss of the essential fat components of the face. So the idea for us, to be prepared for this is patients who are looking at losing 5 pounds, 10 pounds. I don't know that it's going to change a whole lot, but we have to, as far as facial aesthetics, but you have to be prepared for it because, we can start seeing the separation of the fatty pockets of the face. And so the option is that we use hyaluronic acid fillers, volumizers such as Sculptra or L-polylactic acid, or your own fat. For those patients who are taking this particular medicine and also are going to undergo a procedure, we can use fat as a benefit at that time. Now, the issue is that, remember, when we are transferring fat from one part of the body to the next, these fat cells either grow or they shrink. They behave no differently if they're on the lateral thigh than they do when you put them into the face. So if you were to gain weight, the face will also gain weight. You lose weight, the face will also lose weight. So the goal for us is to wait till you have achieved your ideal body weight before we start adding, autologous fat or your own fat. Now, filler can be a different ballgame. So where we're going to see some of this fat loss and sagging of the skin. So the temporal region is one of the key indicators of age. Usually, close to 95% of people above the age of 40 have some form of temporal wasting. And this can be remedied by adding filler deep into the temporal fossa or that pocket, and it can restore some of the youth. Now, we are also going to lose some of the fat that's directly underneath the skin. Now, when you do that, you see more of the facial structure underneath. So if we look at bone and muscle, and you eliminate some of that fat, you're going to be able to see a little more of the capillaries in the under eye region. You're going to be able to see deeper nasolabial folds or laugh lines. You will see sunken cheeks. You will see hollowing of the upper eyelids. You will see the marionette lines form. And the real goal is to slowly add the volume into the area where it's been lost. So, as I said before, when we draw a line right through the neck, you would always rather be healthier on the lower half of your body and add volume to the upper half. Now, this is where some of the treatments that we have for stimulating collagen are going to really come into play. So for those, there are going to be different grading systems of how much of the volume you have lost. So let's say a grade 1 will be where we've got some minor loss. Grade 2 will be where we've moderate loss with partial appearance of the jowl or pre-jowl region. And then a grade 3 that's going to have, moderate skin excess. And usually those grades 2 and 3 will require some type of surgical procedure. So for those of you who are younger and losing weight, the skin retracts, but you still are losing a little bit of volume to the face, my recommendation would be that we add hyaluronic acid filler or Sculptra as a volumizer. There is a new treatment to help make the skin appear more taut, and this is called Profilo. This is a hyaluronic acid that's based out of the UK that is a bioremodeler. And so it's not a volumizer, but what it does, it creates a little more firmness to the skin by drawing in water at its deepest layer in the dermis. The other thing that I would recommend is undergoing some form of microneedling, whether it's microneedling with or without radiofrequency, with or without PRP or platelet-rich plasma, or with or without exosomes, which are the new biologic products that carry all the growth factors within stem cells to help regenerate some of the skin. The idea is we want to tighten the skin and add volume as necessary. So for those of you who are younger, more of a grade 1, or where you've got mild weight loss, you can add little bits of volume, and you also want to tighten the skin. For those of you who are more of a grade 2, where we start seeing a little more hollowing in those areas, you're going to require a little more volume. So if you are at your ideal weight, you can consider harvesting fat and placing that into the face. If you're planning on continuing to lose weight, then that would be a waste of time. Then I would just stick with hyaluronic acids or Sculptra, as that will, those are biostimulatory reagents, which will volumize the face. And for those who have severe weight loss, and again, when you have rapid weight loss, it doesn't matter if you're 35 or if you're 65. Sometimes that skin doesn't retract the way you want it to, and you'll require a surgical intervention. It's the same type of philosophy that can occur with gastric bypass or gastric sleeves or a lap band. When you rapidly lose weight, the skin doesn't have a chance to retract to its what would be normal state at an ideal weight. So this is where, I have seen patients that lose a significant amount of weight. They're in their late 30s and they require face and neck lifts because that skin will not retract. Same thing will apply when we use Ozempic to lose 30 or 40 pounds. The skin may not have the time or ability to retract at that particular rate. So, the use of Ozempic, I think that this is an amazing medicine. It was really targeted at improving our glycemic index or glucose control for those of you who are pre-diabetic or type 2 diabetes. But as a side effect, which turned into a benefit, this is where you have weight loss. On the flip side, you have to be prepared for that particular volume loss. Now, for those of you that are planning on taking this for a short period of time, the idea is you want to change, you will ultimately change your habits and lifestyle. And so once you're at the end of a 3-month course, stomach hasn't been stretched, the way it has been in the past. And so when you lose that weight, the hope is that you keep it off. If you go back to your previous habits, I think you're going to rapidly gain the weight, and now you're going to destroy the skin. And so you're going to stretch that dermis one more time. And again, each time you do that, you lose some of the integrity of the skin. And so, sometimes people who have rapid weight gain and rapid weight loss, you see those stretch marks or striae because you have torn the deeper layers of the skin that are most important. And then the skin cannot contract. It doesn't have the components in order to ultimately restore your skin to the way it was before. So Ozempic Face is only rivaled by Ozempic Body. Now, same thing happens. Imagine that let's say you lose 30, 40 pounds. What do you think happens to breasts? What do you think happens to the thighs? What do you think happens to the buttocks and the abdomen? So if you are carrying more weight and you plan on using Ozempic, be prepared that there is a deflation style effect where you will have excess skin. Breasts drop or become ptotic. Abdomen, there's extra skin. So now you may not like the way it looks in certain clothes, especially bathing suits. And the thighs, that's where we can have what's called thytosis, where now you have a little more of that cellulitic wrinkle at the knee or excess skin at the knee, just because, again, you've deflated the balloon, you've lost that volume, and that is the result. And lastly, buttocks. The idea is when you lose that fat, it's the same thing if you were to, lose massive weight through a surgical procedure or simply through diet and exercise. If usually with diet and exercise, it can be a slower process. And so your skin has the chance in using its components to retract to a point. When you have rapid weight loss, such as can happen with Ozempic and surgical procedures, the skin doesn't have that potential. So in any case, Ozempic should be administered and written as a prescription by a licensed physician. It should be monitored. I know that many people are trying to go around this, and find a compounding area that makes semaglutide. And I've heard some crazy things about people having this particular component making it out of their home. And so, listen, this is not a controlled drug, but should be a controlled substance, meaning that it should be monitored by a physician. And lastly, the idea is you have to be prepared. This isn't something that you should take lightly. Again, this is a medicine to treat diabetics, and to take it simply for rapid weight loss sometimes isn't always the healthiest option.